Welcome to this short presentation on safety and health in the workplace. The information in this video is based on the laws and policies in effect in Illinois as of May 19, 2020. These may change. If you have any questions related to information in this video, please call us at 312-986-4105. This is presented to you by the Legal Aid Society of Metropolitan Family Services, which is one of the first organizations in the nation to provide legal services for the poor. Since 1886, we have been a pioneer in providing justice for all, regardless of ability to pay. We continue our commitment to securing access to equal justice by providing legal representation and assistance. We provide free legal services for matters relating to domestic violence, family law, consumer and housing issues, elder abuse and financial exploitation, human trafficking, wage theft, and victims of crime. All our services are free, confidential, and offered regardless of immigration status or language need. If you think you may need legal help, call 312-986-4105 for assistance, or visit our website at www.laschicago.org. In this video, we will discuss all workers' right to a safe and healthy workplace, regardless of immigration status. Basically, workers have the right to receive the training necessary to do the job safely in a language you understand. They have the right to work on machines that are safe, to receive required personal protective equipment, such as gloves, goggles, helmet, and others, in order to do the job safely. They have a right to be protected from toxic chemicals and to access clean bathrooms with soap and clean water, and have safe drinking water at work. They have the right to report workplace injuries without being fired or retaliated against. They have the right to be free from intimidation, to work in an unsafe environment, and to ask questions if something seems dangerous. Now, COVID-19, or the novel coronavirus, is a new disease, and we are still learning about how it spreads and the severity of the illness it causes. To understand how this virus may impact our health and safety in the workplace, let's watch this video.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
In order to keep ourselves and everyone safe in our community, changes have been made at the state and federal level. Illinois Governor Pritzker, through Illinois Executive Order 2020-32, requires that everyone in Illinois must wear a face covering when out in the public or at the workplace. So it means that in Illinois, there are also additional guidelines required of businesses and in the workplace in general. One of them is that all businesses must evaluate which employees are able to work from home and are encouraged to facilitate remote work from home when possible. All businesses that have employees physically reporting to a work site must post the guidance from the Illinois Department of Public Health and the Office of Attorney General regarding workplace safety during the COVID-19 emergency. This guidance may be found in their website, idph.gov. Second, any individual who is over the age of 2 and is able to medically tolerate a face covering, which is a mask or a cloth that covers the nose and mouth, shall be required to cover the nose and mouth when in a public place or in a public location indoors. In a public place, it is required when they are unable to maintain a 6-foot social distance. And face coverings are required at all times in public indoor locations, such as stores, hospitals, and clinics. For purposes of this executive order, social distancing requirements also require at least 6-foot social distancing from other individuals at all times in business locations. So this means that essential businesses, or those that are designated as such, or businesses that have minimum basic operations, and these list of businesses may be found in the executive order. They must take proactive measures to ensure compliance with social distancing requirements, including the designation of 6-foot distances with signage, tape, or by other means, in order to ensure 6-foot spacing for employees and customers in line to maintain appropriate distancing. The use of hand sanitizer and sanitizing products and having them readily available for employees and customers. To have and implement separate operating hours for the elderly and vulnerable customers, and to have online and remote access to post online whether a facility is open and how to best reach them, and allow the continuation of services by phone or remotely. And fifth, to require face coverings and PPE, or personal protective equipment. Providing employees with appropriate face coverings and requiring that employees wear face coverings where maintaining a 6-foot social distance is not possible at all times. When the work circumstances require, they must be provided with other personal protective equipment in addition to face coverings. For instance, in hospital or clinic settings where an N95 mask might be the appropriate face covering over a regular face mask, and the use of gowns and rubber gloves if needed. In addition, manufacturers that continue to operate pursuant to the order must follow social distancing requirements in another way. Aside from providing face coverings to all employees when they are unable to maintain 6-foot social distancing at all times, they must also implement staggered shifts and reduce line speeds, operate only essential lines while shutting down non-essential lines, ensure that all spaces where employees may gather, including locker rooms and lunch rooms, allow for social distancing, and to generally downsize operations to the extent needed to allow for social distancing and provide a safe workplace in response to the emergency. This is from the Department of Public Health website, dph.illinois.gov. Anyone with COVID-19 like illnesses can get a test even without a doctor's order or prescription. So, testing is available for anyone who may have symptoms or have a risk factor because they might have been in contact with someone confirmed to have COVID-19, or they have a compromised immune system or serious chronic medical condition. Testing is also always available for those with or without symptoms who, because of the kind of work that they do, would allow for testing to happen. So, those who work for a healthcare facility, work in correctional facilities such as jails or prisons, who serve as first responders such as paramedics, emergency medical technicians, law enforcement officers or firefighters, and those who support critical infrastructure such as workers in grocery stores, pharmacies, restaurants, gas stations, public utilities, factories, childcare, and sanitation. On the website, again, dph.illinois.gov/testing is where you can find a map of testing sites near you. And so you can just type your zip code to generate the list of testing sites near whatever location you desire in Illinois. It must be emphasized that persons experiencing financial insecurity must be informed that the receipt of care related to COVID-19 is not contingent upon insurance, financial status, or ability to pay. Second, undocumented individuals should be informed that their receipt of care related to COVID-19 is not contingent on their immigration status. Even persons with limited English proficiency should be encouraged not to delay or avoid seeking medical treatment due to their limited English proficiency. Healthcare institutions in general are required to take reasonable steps to ensure services are accessible. With our current emergency situation due to COVID-19, we emphasize that workers' rights are not suspended. Workers are always entitled to a safe and healthy workplace, to be paid for the work, and to report any abuse or safety concerns. We have a federal, state, and city law around whistleblower protection, where a worker who reports a concern cannot be fired or made to suffer any other form of retaliation, like, for instance, reduced work hours, harassment, or intimidation. Examples of any abuse or labor exploitation can be the following, but is not limited to these in this list. First, the violation of labor laws, such as minimum wage laws, pursuant to city ordinances, state or federal minimum wage laws, or workplace safety requirements. Lies and false promises about the working conditions or the pay. Denying someone all or part of their wages. The confiscation of passports and other personal documents. Forcing to work long hours with little rest. If a worker has to live where they work or rely on their employer for housing, food, or subsistence, threatening the worker with deportation, detention, or arrest, and general threats of harming the worker, their families, co-workers, or friends. Know that there are different ways to seek help. One way is by filing a complaint with the Occupational Safety and Health Administration, or OSHA. It's an administration under the US Department of Labor, and this is their website. If you want to know more, contact us at 312-986-4105. Another way is by filing a report with the Illinois Attorney General's Office Workplace Rights Bureau. Visit their website, found here at www.illinoisattorneygeneral.gov, and file a complaint online or call them or email them as well. Those who work in the city of Chicago can also seek help through the city's Office of Labor Standards. Here's their website, and you can also initiate a complaint by calling 311. If you have any questions, again, feel free to call us at 312-986-4105. Our agency also offers free resource calendars with a variety of information with blank monthly spaces. Anyone can use this to fill it in order to write down the days and times of work, workplace issues, or any other work-related matters. It also has a lot of helpful information on a variety of topics, such as workers' compensation, taxes, public benefits, applying for a driver's license, and others. If you would like to request free copies of our calendars to be mailed to you for free, or to ask us any other questions, please call us at 312-986-4105 or email us at trafficking@metrofamily.org. Thank you.